This is Dr. Ravi Kiran, General Physician and Diabetologist at Onus Robotics Hospital, Champapet. Let's discuss about insulin resistance, which is the root cause for all of the metabolic problems. Let's get it about into detail so that we can educate and we can prevent ourselves from having dreaded diseases like diabetes. Many people think diabetes, high blood pressure, obesity, fatty liver, PCOS, and heart disease are all different problems. But in reality, they are all connected to one hidden cause, insulin resistance. These all diseases are a form of are a spectrum of metabolic syndrome and the complications of metabolic syndrome. So we have to control our insulin resistance to stay healthy and to prevent a plethora of conditions. What is insulin resistance? Insulin resistance means your body produces insulin, but your cells do not respond properly to it. The body keeps on producing insulin, but due to the higher values of persistently high values of insulin, there would be resistance from the body cells to the action of insulin. Results: sugars stay in the blood, pancreas produce more insulin, high insulin plus high sugar is equal to metabolic damage. So this is a negative vicious cycle where one thing leads to the other, another thing leads to another, and the cycle keeps on propagating, causing us more harm again and again. Secondary to insulin resistance, the sugars would be high. As the sugars are high, more insulin will be coming into the blood. As there is more sugars, the more insulin resistance develops and the negative cycle keeps on continuing. Normal insulin action versus insulin resistance. In normal cells, insulin enters the bloodstream, goes to a cell. It opens the cell's doors to accept the glucose into the body. Where the doors are opened, where the glucose enters into the cell, glucose gets metabolized, energy is produced, and the body feels to work. In insulin resistance, insulin is present in the cell, but the cells ignore the insulin signal. As the cells are not responding to insulin and the sugars are persistently high, pancreas are forced to increase insulin output. As the sugars are still high and insulin is high, fat storage increases because insulin is a storage hormone. As the cells are not utilizing the sugars properly, insulin forces the fat cells to form more fat from the present sugars. This condition exists years before diabetes appeared. Normally, what should happen is, as the insulin comes out, a cell should take up the sugar. In insulin resistance, as the sugars are not being taken up by the glucose cell, the insulin forces fat cells to accommodate more of the insulin and to increase the visceral fat process. This is the most problematic and dangerous thing, which causes negative vicious cycle. Why insulin resistance is so dangerous? Because it stays silent for years, affects every single organ, worsens with time as it's a negative cycle, is reversible in early stages, is the common cause of multiple diseases. As I'm again stating you, BP, sugar, cholesterol, obesity, these four form as part of metabolic syndrome. PCOS is a part of metabolic syndrome. Diseases caused by insulin resistance. These are the conditions which are the most common causes which we see in our everyday life, but we are not concerned. On the left are the common conditions which we know. On the right are the less common conditions which we don't know. Type 2 diabetes, pre-diabetes, obesity, hypertension, dyslipidemia. These four causes are secondary to insulin resistance. Even high blood pressure also occurs secondary to insulin resistance because insulin has a tendency to retain salt, which causes more salt retention and increased blood pressure. The less commonly known conditions like fatty liver, non-alcoholic fatty liver disease, which is the most common condition which I've seen in urban population, PCOS, heart disease, stroke, erectile dysfunction, gout, sleep apnea. These all are conditions which are caused by insulin resistance. This cluster is called as metabolic syndrome. When all of these things are present in a person in varying probabilities, that is called as metabolic syndrome. How insulin resistance develops? Highly refined carbohydrate intake, which recurrent refined carbohydrate intake causes blood sugar spikes. Whenever there is a blood sugar spike, the insulin is forced to spike to control the sugar. Therefore, repeated insulin spikes. As there are repeated insulin spikes, the cells stop responding to insulin and they protect themselves, they become resistant. As the cells become resistant and the cells don't respond to the normal levels of insulin, pancreas is forced to produce more insulin, hyperinsulinemia. As the pancreas are forced to release more insulin over time, the beta cells exhaust. The beta cells lose their function and they become exhausted. Prediabetes is the initial conditions of insulin resistance. After some years, type 2 diabetes develops. After type 2 diabetes develops, after some years, complications develop. Why Indians are more insulin resistant? Thrifty phenotype. This we have already explained in the previous terms. where thrifty phenotype is the genetic type where our ancestors have been habituated to famines for over longer duration of time. Therefore, our bodies are more genetically modified to store whatever energy we get. That's why we have the chance of developing more obesity, more visceral obesity, and more genetical predisposition. Higher visceral fat at lower BMI. This is what we have been stating. This is secondary to the thrifty phenotype. Lower muscle mass, high carbohydrate traditional diet, sedentary lifestyle, poor sleep and chronic stress. This explains early diabetes and heart disease in Indians. We are at least 10 to 15 years faster at developing these conditions than our Western counterparts. Insulin resistance and belly fat. As we have already read that insulin resistance leads to belly fat in turn leads to many of the secondary complications that we develop. The visceral fat releases inflammatory chemicals are also called as cytokines, which in turn worsen the insulin signaling, worsens resistance and feeds a vicious cycle. Belly fat, insulin resistance, more belly fat. That the cycle keeps on happening until it becomes toxic for the person. Insulin resistance and obesity. High insulin. Insulin is a fat storage mode. Whenever there is high insulin, insulin forces the body to store the sugars as a form of cholesterol because insulin is a storage hormone. So whenever there is high insulin, the body is under storage mode. So whatever food we consume, whatever the cholesterol we have in the body won't get breakdown. What happens in insulin resistance is even when you're fasting, if you have been fasting for the past 8 to 10 hours also, because of insulin resistance, there's a high insulin values, which prevents the fat from breaking down to produce sugars. What happens is the patient develops weakness, malaise, even with the normal fat cells because the body is not able to utilize the fat and cholesterol because insulin is blocking that action. Hunger increases, weight loss becomes more difficult. This is the reason why diabetic patients don't lose weight. Because of their insulin resistance, the fat breakdown never happens and that's why they never lose weight. This is why many people say, I eat less but still gain weight. The root cause is insulin resistance. We address the insulin resistance, the weight loss automatically happens. High resistance and blood pressure. High insulin causes sodium retention, activates parasympathetic nervous system, stiffens blood vessels. If all of these combine to cause hypertension. Therefore, high insulin is equivalent to hypertension. Insulin resistance and cholesterol. Typical pattern, because insulin is a storage hormone, the triglycerides are high, the good cholesterol low, HDL is low, and LDL is highest, most dangerous is the highest form. This lipid patterns greatly increases heart attack risk. Insulin resistance and fatty liver. Excess glucose is converted to fat in liver. Fatty liver worsens insulin resistance. Insulin resistance and fatty liver, they work in tandem. As the liver gets accumulated in the fat, the liver cells are not able to function properly and they stop responding to insulin, which leads to insulin resistance, leads to inflammation and fibrosis. Non-alcoholic fatty liver disease is now called as metabolic associated fatty liver disease because these all are secondary to metabolic syndrome. The metabolic syndrome associated fatty liver disease. Insulin resistance and PCOS. Whenever the insulin levels are high, they indirectly increase the androgen levels, the male sexual hormones, even in the females also. Therefore, high insulin leads to high androgens in the females, which leads to irregular periods, infertility, acne, hair fall, weight gain. So, PCOS patients are treated with metformin. Metformin is one of the first line drug for diabetes. It's also the first line drug for insulin for PCOS because metformin reduces insulin resistance and that's why it's used for the treatment of PCOS. How to detect insulin resistance? Early markers, please look for these things in your body. Increased waist circumference, acanthosis nigricans, where there is darkening of skin over the neck, fatty liver on ultrasound, high triglycerides, low HDL. Lab indicators include the blood tests which we can do for ourselves to confirm insulin resistance are fasting insulin levels which are high, HOMA-IR which is elevated fasting glucose and elevated HbA1c. These all are indirect markers and direct markers for insulin resistance. The most important question which we want to talk today is, can insulin resistance be reversed? Yes, especially in the early stages. In early stages, there can be 100% insulin resistance reversal. The key principles are reduce insulin spikes by reducing the highly processed foods, increase insulin sensitivity by increasing activity, reduce visceral fat, protect beta cells. Always remember, muscles are called as glucose sink because they utilize up to 80 to 90% of the glucose is utilized by the muscle cells. Once you start increasing your activity, automatically the muscles start utilizing more sugars without the need for insulin, and automatically insulin sensitivity betters. Diet strategy to reverse insulin resistance. Reduce refined carbs and sugars. It means avoid all foods which comes in a packet. All processed foods or all storage foods which are present on shelves, they have a longer duration of shelf life because they have large amount of sugars or salt to protect their shelf life. Therefore, whenever you consume those food, our sugar spikes rapidly. Control the portions of rice and wheat or control the portions of carbohydrates as such. Make sure you follow a calorie restricted diet up to based on your height and weight. Increase protein in every meal. Add fiber rich vegetables. Avoid sugary drinks. Eat early dinner. Time restricted eating. This is not for all. Whenever it's suitable, we can advise. So portion control and counting the calories is the most important thing to reverse insulin resistance as a part of your diet. Also, always remember, health starts in the kitchen, not in the gym. For us to stay healthy, the diet is the most important thing, followed by exercise. Exercise strategy. Walk more than 30 minutes. Advisable is walk at least 45 to 60 minutes per day. Strength training 3 times a week. Post-meal walking, these things. Always remember, whenever you do only cardiovascular activity, it means only walking or any cycling, there would be muscle damage secondary to recurrent cardiovascular activities. The repeated movements of the cardiovascular activities leads to muscle damage. So to prevent further muscle damage, strength training is the most important thing. That's why you do cardiovascular activity daily for 45 to 60 minutes. Resistance training 3 times a week to prevent the damage from the cardiovascular activity, and post-meal walkings to control the sugar spikes. Apart from these things, even stretching exercises are also important to prevent injuries. Sleep and stress control. These are the two most important things which we many a times omit these things in diabetes control. Sleep less than 6 hours leads to insulin resistance, where the insulin resistance increases by 20 to 30%. Because of insulin resistance, there won't be any weight loss even with diet. Chronic stress causes increase in cortisol, increases in sugar. Yoga, meditation, breathing exercise help in reducing the insulin resistance. Medications that improve insulin sensitivity. Always remember, medications are the last thing that can help us to improve insulin sensitivity. Insulin sensitivity should be improved only by doing diet and lifestyle changes and stress and sleep management. But there are some medications like metformin, pioglitazone, GLP-1 receptor agonists, SGLT2 inhibitors I can use to improve insulin sensitivity. Metformin is the first line drug to improve insulin sensitivity. That's why this is also the first line drug in treating PCOS. When insulin is needed, despite resistance. There are many times where we advise patients to have insulin even when they have insulin resistance. Those conditions are very high sugars where they have become very toxic for the body, glucose toxicity, acute illness, pregnancy, advanced beta cell failure. Myths versus facts. These are the things which we have to first, because many times many people are misguided myths. Insulin resistance happens only with this myth. But the truth is, thin Indians can also be insulin resistant, especially people who are having